everyone, my name is Dr. Baptiste. Welcome back to my channel. Today I'll be providing more tips for junior doctors. If this is the first time you're joining, then have a look around. I'm sure you'll find something that'll interest you. And if you like what you see, then why don't you subscribe? Okay, so I thought I would start the video by just going through what a typical day might be in a medical or surgical specialty. So every job that you have will start off with a ward round. This is where the whole team you're working with will go and see the patients under that team. So if it's a medical specialty, you'll generally be on your own ward, and the consultant or the registrar will lead the team of doctors. Sometimes a nurse will join, sometimes a pharmacist will join. It all depends on where you're working and what specialty you're in, and if they need additional expertise. So you'll start medicine, it's generally at 9 o'clock. Again, this might vary depending on what ward you're on. When I was an F1 starting in cardiology, one particular area of the ward you'd start at 8:30, so you'd have to be in quite early to get things ready. So as the F1, that's one of your duties. You get things ready for the ward round. You start the ward round, you see all the patients, you'll have a patient list with all the patient details, and you'll have sections, medical history, jobs to do, etc. And then you obviously annotate as you go along on the ward round. So you collect jobs from the ward round, and then after the ward round is done, medicine, the ward round generally lasts a number of hours. Again, it depends on the specialty, but compared to surgery, the ward round is much longer. You'll then have the rest of the day to complete your jobs. And this is in addition to anything that crops up on the ward. So a sick patient, you might have some meetings to go to, MDT meetings, so that's multidisciplinary team meetings. And then sometimes you'll have teaching as well that you have to leave your ward duties for. That's pretty much how the day works. You'll get in earlier, so if your ward round generally starts at 9, then you might want to get in at 8 o'clock. Sometimes you'll have new patients coming into the ward, so you'll need to then get their details, find out what their presenting complaint is, find out their medical history, any investigations they've had before, like bloods. So like I said, I had cardiology as one of my jobs as an F1, and I would generally get in at about 7:30, 7:45, and then I would get blood results, echo results, etc. Prepare the list, update the list. And then again, it depends on what specialty you're on, but your day might finish at 5, 6. It really depends, but most days are quite long anyway. In surgery, the way it works is that you don't have your own ward. You have surgical wards, but your patients are scattered across the surgical wards. So you might have 4 surgical wards, and then your patients are scattered. So you have to then know exactly what wards your patients are on, what beds, to make things more efficient and smooth when you're going around with the consultant. Well, this was my experience anyway. It might vary. And again, you do the ward round, you collect the jobs, and then the rest of the day is really spent doing those jobs in addition to anything that might crop up, again like a sick patient for instance. Now in terms of on-calls, it does vary depending on what stage you're at. F1s generally don't have that many on-calls compared to obviously registrars and senior doctors and SHOs. There are different types of on-calls. So you'll have an on-call in the weekday, so you do your normal ward jobs, you do your normal ward work, and then after 5 you could be going around the hospital managing and looking after all the different wards, and people will bleep you or contact you to tell you what jobs need doing. So say you start at 9 o'clock, you finish at 5, 5:30, you generally have an on-call bleep or on-call number, and then that's how people will contact you to hand over jobs from the day. So it could be, there's a blood result that hasn't come back just yet, could you please check the result and then act accordingly, or these are the instructions, this is what you should do if the result is this, this and this. And then some nurses will contact you if there's a sick patient or something needs to be done, like a blood test or a cannula has come out for instance. And then at 9 o'clock you'll go to the place where everyone has a handover meeting, and then you'll hand over what you could do, what you couldn't do, what needs following up basically. And just you can ask questions, I guess, but you hand over to the night team. So that's one on call. So the first on call I was talking about was you do your normal jobs in your ward, and then in the evenings you do the jobs that are generated throughout the hospital. Then you hand over in the evening. And then you'll have another on call where you're not on your ward, but you are in A&E, and this is again in medicine. Surgery is a little bit different because the SHO generally clerks the patients and sees the patients in A&E. But if we stick to medicine, you could be with the on-call team in A&E, and your job is essentially patients that come in, they'll be on a big list, and you essentially pick a patient on the list in terms of urgency, for instance, and then you see the patient. Sometimes the registrars will call you and give you a patient to see, which they think is appropriate for you and your level potentially. But some places, I know certainly for me when I was working, it depends on the registrar, it depends on who you're working with. They just say pick a patient and just see the patient. I mean, the good thing about on-call is that, you can ask questions. There are loads of senior doctors. There are consultants, doing a mini ward round throughout the evening. So they might contact you and say, have you seen this patient? Can you give me a brief update, a brief history? Can you present the patient to me, essentially? And I think on-call is a very good place for you to get procedures and competencies done, but I'll talk about that a little bit more towards the end of the video. So that's the second on-call. And then obviously you have nights. Now, when I was working as an F1, I didn't do nights because the hospital where I was working, the F1s just didn't do nights. That again varies depending on where you work. Some F1s do nights, and so you'll come in at 8:30 or 9 o'clock, whenever the handover meeting is. Some places it's 9:30, but generally it's 8:30 to 9:30, I would say, as a range of times. And then you sit there, you take on the jobs that the day on-call team are passing on to you. There are two different things you'll do at night time. You will either be on the wards and doing all the ward jobs, anything that crops up on the wards, or you will be in A&E clerking. Sometimes you might have to leave the ward jobs to help in A&E and clerk the patients if it's really busy, but generally that's the two things you do at night time. So that's a really, really brief overview of typical kind of day and on-calls. You may have already experienced some on-calls as a medical student, so you may know this already, but this is roughly how it works. Okay, so now I'm going to start talking about tips, lovely, juicy tips. The first tip is really important. Make sure you get your contract and read your contract before you start work. Now, I know this doesn't always happen. You should be getting your rota for your regular day job 8 weeks before, and then the on-call rota at least 6 weeks before you're due to start. When I was working, sometimes I didn't get my rota and my contract until I had started, then I was well into the job. So it's very difficult in some places, but this is what should be happening, and you're well within your rights to inquire as to why it's not happened, and the BMA is a very good place to start with getting advice. The other thing I would say about contracts and rotas is that if you're not sure, you need to really ask for help. It's really important you know the terminology in your contract, what you're entitled to, what's expected of you. The BMA check contracts, and if you're not sure and you've asked a colleague or you've asked someone and they're not sure, or it's not completely clear to you, then I would contact the BMA, because they can check your contracts and they can run through anything that you're not understanding or not sure about. Related to contracts and rotas, etc., would be things like your payslip. If this is your first kind of real job in the NHS, then again, there's a lot of things on there that potentially you may not understand. So you can also go onto the BMA website. You can also contact the BMA via phone, and they can run through your payslip with you. I would really learn about payslips, contracts, rotas now, and what the trusts and hospitals are legally obliged to do before you get deeper and deeper into working life. So hence why it's really important to be a part of the British Medical Association, the BMA. I have left a link in the description below if you're not a member, so you can sign up. There's other things as well that they can offer you as a member. The website is a really good place to start. So like I said at the start of the video, as an F1, you are essentially the backbone of the team. So people might think that actually the F1, you're quite low down the ranks, you're not really important. But an F1, I would argue, is really important. If the F1 is not there updating the list, doing the bloods, the cannulas, then the senior doctors have to leave what they're doing and take on those extra jobs. And if it's a busy ward, then you really miss having an F1. Don't think you're going in there and your job isn't important, because it's a very, very important. Now, like I said earlier, the F1's job, one of their jobs is to update the patient list, create the list, keep track of the jobs, what's been done, what hasn't been done, what's urgent. It's really important that you're organised. So the way you can be organised is making sure your patient list is up to date. So try and come in a bit earlier where you can update the list with any new patients. Sometimes your patients have actually moved, and sometimes you have outliers, so patients that are assigned to your team but are not on your ward. So you need to really be organised with all of that. You also need to make sure that you update your list in the evening. And this will definitely help you because sometimes you don't always have new patients coming in if your ward is really full. So actually you can come in and just mull over a few things, check if there are any investigations are back that weren't back from the day before and that obviously aren't urgent, and just get really organised and prepared. And this will put you in good stead for working with your team and impressing your team. Your consultant, your registrar is going to be really impressed if you're efficient, you're organised, and you know your patients. And the list really helps with knowing your patients, knowing what needs to be done, and just keeping on top of everything. The other thing I would say is that if you're away one day for annual leave or you're unfortunately unwell, if the list is updated and very easy to understand, very easy to follow, then your team's life will be made much easier because you would have created something that will help them in their day-to-day job, and they won't have to worry about what does this mean, what's the list about, this is very messy. It would actually be very, very clear, and trust me, they will definitely appreciate it, especially if the ward is really busy, which most of the time it really is. Another important point in terms of the list and jobs that are generated from the ward round, please ask if you're not sure. Often the F1 will have to go and discuss the imaging request, especially if it's a CT with the radiologist. And the radiologist will ask you questions, and they'll definitely ask you, why does it need to be done? Why does it need to be a CT? Why not maybe an ultrasound or some other imaging modality? You ask your consultant or registrar or even your SHO. Most of the time, I'm sure they will explain it to you because it's for the good of the patient. They want you to be able to get this x-ray or this imaging done, and so they would most often than not explain it to you. Also for your learning, it's really important that if you're not sure why something needs to be done, that you ask. And the other thing I would say related to this is that make sure you ask questions. I have spoken about this in a previous video, but asking questions is so important, especially now. People are going to be more forgiving of an F1 who's just come out of medical school, who doesn't understand something, than an SHO who's been on the ward for a couple of years. So I would say also, don't worry about anything. I know it's going to be hard, and I know it's easier said than done. Trust me, I know. But honestly, don't worry. Your first day, you're going to have to get used to the hospital surroundings if you haven't been to the hospital before. You're going to have to get to know the hospital system. You're going to have to get to know the staff, your patients. So there's a lot to do, and people will know that you're new. And nurses, your other team members, your other, the doctors on the ward and on other wards will help you. So try not to worry. So things like bloods and cannulas and catheters, they do take some time to really get good at, especially in some patients where their veins may not be as good. They may not be a healthy, young, fit person. You might struggle, especially in someone who's quite elderly and frail. It just takes time. It takes a lot of practice, and you're in the right place. You're going to be there every day, so you'll be practicing. So please don't worry about things that maybe you're not so good at, because you will become better at them, especially when you're doing your own calls. So it's really important you keep on top of your portfolio. You're going to be doing a very busy job. Even if you're not, it's still good practice to keep on top of your portfolio. Make sure, like I said earlier, when you're on call, it's a really good opportunity to meet a number of different doctors from different specialties and get to know different people. And they can watch you do examinations, they can watch you take a history. You can get really good knowledge and experience from these doctors who you're not working with every day. So I would really use opportunities during on call, and of course with your team in general, to just get your procedures and get your competencies done. Try and see if you can do one every week or every couple of weeks. It all adds up. There generally is someone who is quite keen to watch you, give you some feedback. Now, you have to attend teaching during your foundation years, or teaching when you're retraining anyway, and clinical duties don't always allow for you to get to teaching. But when you can go to teaching, you really should go and try and make the most of it, and just try not to think about what you have to do on the ward. Try to just immerse yourself in teaching, and just try and take as much as you can from the different topics that you're taught. So I've done a previous video for junior doctors, and you might want to check that video out too.